Good morning and welcome to the University of Minnesota. And thank you to Vice Chairman Anderson and other members of your community for joining us here today. We're extremely pleased to host the Shakopee Mdewakanton Sioux community and honored to be its only higher education partner. They are making a very significant announcement today for Native Americans' health in Minnesota and across the country. As background, we at the U and the Mdewakanton Sioux have enjoyed wonderful partnerships, and we're glad to play a role in this news today because of our mutual interest in public health, particularly the health of Native Americans. Of course, the Shakopee community has been an incredible advocate for Native American students, having established a $2.5 million endowed scholarship here at the U to help educate the next generation of Native American leaders. Over the past 6 years, 192 students have benefited from this scholarship program. The Mdewakanton Sioux has also been a great supporter of university athletics, contributing $10 million to the construction of the TCF Bank Stadium and to build the Tribal Nations Plaza, which is an enduring symbol of the significance of Minnesota's 11 Native American tribes. And in fact, Minnesotans should know that the Mdewakanton Sioux's generosity has made it the largest philanthropic benefactor in Indian country nationally for the past 2 decades. The SMSC is also one of the largest charitable givers in Minnesota. The lives and well-being of both Native Americans and non-Native Americans across our state and our country have been improved because of the long-range vision and the good works of the SMSC. I'm grateful to the SMSC Business Council, especially Chairman Vig and his team, Vice Chairman Anderson and Secretary Treasurer Lori Watso for their leadership and their friendship. And so again, thank you for joining us. We're honored to be partners with the Shakopee community, and it gives me great pleasure to introduce to you the Shakopee Mdewakanton Sioux Vice Chairman Keith Anderson to make this important announcement. Keith.
Good morning, everybody. Thank you, President Kaler. On behalf of the Shakopee Mdewakanton Dakota community and its Business Council, I would like to thank you all for being here today. I'm joined by my fellow council member, Secretary Treasurer Lori Watso, and I bring a message from our chairman, Charlie Vig. He wanted to be here for this exciting announcement, but he had to travel to Washington, D.C., and he extends his regrets. I know that was pretty important for him to go, and I'll be meeting with him later this afternoon in Washington. But we're here to announce our part in identifying poor nutrition, which has been a major problem for tribes in America for many generations. Our ancestors lived in close harmony with the land and were able to sustain a healthy diet, rich in nutrition, high in protein, and very little starch. Of course, many factors have contributed to the loss of our native foods. Decades of poverty and those factors have resulted in poor and inadequate diets for many native families. Native populations now experience increasing obesity, diabetes, susceptibility to disease, health problems reoccurring from generation to generation. The state of nutrition for Native people has been one of silent crisis for generations. Fortunately, there are organizations and individuals working across the country for years to identify the causes of these crises. Tribes, nonprofits, researchers, public health officials, and grassroots advocates. Their work lays the foundation for real, workable, permanent solutions. And that's why we're here today, to give support to these efforts. Joined today by 3 outstanding strategic partners, the Shakopee Mdewakanton Dakota community is pleased to announce the launch of Seeds of Native Health, a campaign to improve nutrition for Native people across the country. Seeds of Native Health will raise greater awareness of the nutritional crisis for Native people, lend its support to existing practitioners, and recruit new helpers in this battle is something we'll work strongly towards, with the ultimate goal of permanently improving the diets of Native people, better health and longer life expectancies, a reduction in health disparities, and the transformation of our communities. Seeds of Native Health will bring a multifaceted effort that will include grant making, best practices, capacity building, research, education, and outreach efforts. The Shakopee, Mdewakanton, and Dakota have committed $5 million to launch Seeds of Native Health. And we will be asking other funders and strategic partners to join us in this campaign. So now I would like to introduce our own champion of health nutrition in our own community. At Shakopee, she has initiated organic food producing efforts and making it accessible and bringing education and nutrition to our members. My fellow council member, Secretary Treasurer Lori Watso. Thank you.
Thank you very much, Keith. That was a very nice introduction. Good morning, and thank you all so much for being here. I'm so honored to be a part of this morning's gathering to launch Seeds of Native Health. I really believe that this will be a game-changing initiative, one that brings together many experts who are individually making strides in Native American nutrition. I know change can happen. Healthy foods can lead to healthy Native people, healthy Native families, and strong Native communities. I've spent much of my career in health, community health education, and public health, and I've seen firsthand the detrimental effects of poor nutrition in Native communities. You can look at just about any health socioeconomic indicator and find that Native people are disproportionately affected. And if you look further, you often find that diet is either a direct or a contributing factor to the acute and chronic health conditions that Native people face each and every day. 33% of Native Americans are obese. Our people are almost twice as likely to become obese as Caucasian Americans. 15% of Native Americans suffer from type 2 diabetes. That's more than double the percentage of non-natives. And we find in the work that's being done by some of our partners here that about 80% of the battle in fighting obesity and type 2 diabetes lies in inadequate access to healthy food, which is a challenge for all of our communities. And I want to say another very startling factor, something that is of great concern, is the number of children in our communities that are developing type 2 diabetes. Seeds of Native Health will support organizations and programs that are going to increase access to fresh and healthy food. At the Shakopee Sioux community, we've made our own modest efforts to help our members learn about and have access to good nutrition. Wozupi is our tribal garden, which grows organically grown produce and an organically grown orchard. And in addition, we have a natural food store called Mzopia, which offers locally produced and sourced whole foods. But our community is not alone in these efforts. Hundreds of tribes and organizations have made their own attempts to improve diets in their own communities, and they've done some great, great work. But often support and encouragement needs to come from the outside. The leading organization nationally to provide that kind of support has been the First Nations Development Institute, headquartered in Colorado. Over the past 35 years, First Nations has grown into the leading nonprofit directed to asset-based sustainable development in Native communities across the country. In 2001, First Nations launched the Native Agriculture and Food Systems Initiative, which stimulates and supports work in Native American agriculture, food system development, food security, food sovereignty, and nutrition, and its work in Indian country is unparalleled. We're so glad that they have joined this initiative as a strategic partner, and the SMSC is pleased to provide $1.4 million to First Nations to fund grants for projects related to tribal food sovereignty, food access, and improvement in food systems. I'm delighted now to introduce Michael Roberts, President of First Nations Development Institute, to talk about their good work.
Thank you, Lori. And I just want to say thank you to the Shakopee tribe for including us in this initiative, and thank you to the University of Minnesota for hosting this event. Thank you for allowing me to speak today. My name is Mike Roberts. I'm the president of First Nations Development Institute. As Lori indicated, we've been doing work in reservation communities for 35 years. About halfway through our work, we kind of reflected and realized that much of our funding that we were putting out to Native reservation communities were in the areas of food systems and agriculture. And so we made a conscious effort to make an initiative around that. And this initiative really parallels with our work on economic development, and has also allowed us to invest and work alongside folks like Lori and the Shakopee tribe in some of their work around agriculture and food systems work. We know that accessing healthy food is a challenge for many Native American families and communities. Let me restate that a bit. We know that accessing healthy, plentiful, and affordable food is a daily challenge for many Indian communities and Indian families. And so we are working on that, and we're very excited about the Seeds of Native Health initiative on the part of the Shakopee tribe to address those very issues. In saying that, I'd like to say that it's more than just an investment by Shakopee that makes us proud to be here today. In the Shakopee tribe, we think we found a kindred spirit in the way in which we look at the work that we do and the investments we make. At First Nations, we always tell folks that we don't do the work. We're kind of like the BASF of Indian country, right? We don't do the work, we just make it better, right? So the real work in Indian country, the real work happening to make change in Indian communities comes from the vision of Indian communities themselves. And what we do at First Nations is we provide a little bit of technical assistance, a little bit of finance, and a whole lot of trust in the partners we work with. And working with Lori and the folks at Shakopee, we have found the same sort of spirit of investment. Lots of encouragement and lots of trust and lots of hands-off approach to the work. And I think this is something that the greater foundation community could learn a lot from. Lori and I have had these conversations at great length in the past, that the work that Shakopee does, and more importantly, the way in which it does its work philanthropically, can be a real model for the foundation community at large. We are very excited that this initiative is out there. From First Nations perspective, we've seen a lot of projects in Indian country around food, diet, health, and hunger. I mean, there's lots of, you can put all the different kinds of adjectives and verbs and nouns in there as far as what's going on in Indian country and what the needs need to be addressed. But, an investment on the part of Shakopee will further the work that we're doing as First Nations, whether that's farmer apprenticeship programs in New Mexico, whether that's bison distribution programs in South Dakota, or even the revitalization of traditional gardening and eating programs in Arizona. So there's lots of projects out there, very innovative projects. They're happening in Indian country. And we really think that the leadership that Shakopee is providing with this initiative is going to bring other investors in. First Nations, for the last 10 years, has been part of the Sustainable Ag and Food Systems Funders Network. This is a group of 100 funders, national foundations, who are investing in food, diet, and health issues around the country. I think they're ready to jump in and fund Native American programs and looking for someone to lead the way. And thank you for the folks at Shakopee. I think this leadership is going to bring more of those 100 funders into the fold. I just want to say that before I step off here, we are thrilled to be in this initiative with our friends and partners in the Notah Begay III Foundation, and we are flattered as heck to be part of this initiative on the part of Shakopee. So thank you today. Good to
Thank you, Mike. I think your leadership at First Nations will provide us with a great partnership for this campaign, and it's nice to have met you and get to know you, and we'll look forward to working with you. I also think it's important to mention a few things about our community, the Shakopee, Mdewakanton, Dakota. We have a long and deeply held tradition of sharing and helping others, and it's an integral part of who we are. It is this reason we work closely with our neighbors, the city of Prior Lake, the city of Shakopee, and the county of Scott, and also our efforts to help make positive change occur with our fellow Native American tribes. We also help out other organizations, Native American and others, across the state and the nation. And it's very important for us to recognize that these are our members. that provide these donations. And thanks to our members, they have given over $325 million to tribes and organizations and various causes over the past 30 years. And they have also provided over $500 million in economic development loans to other tribal governments. I'd like to at least recognize some of our community members that are here today. I won't make you stand up or anything, but it's good to see that they're here in support of this initiative, and it's my distinct honor to be able to stand up here and represent them. And we continue to keep our traditions alive and improve the nutrition and the health of Native people across this country. I also have the distinct honor of introducing another strategic partner, Notah Begay III, and also known for his foundation, also known as Env3, was created by his namesake. 4-time PGA winner in broadcast analysis. The Env3 Foundation is the only national Native-led nonprofit dedicated to the health and wellness of Native youth. Much of their efforts are focused on combating childhood obesity and preventing type 2 diabetes. The foundation has served over 24,000 Native families and children since its inception in 2009. Our community will provide the foundation with $1.1 million to support youth-focused nutrition improvement. So to talk more about this, it's my great pleasure to introduce my friend, Notah Begay III.
Well, thank you, Vice Chairman Anderson, for those kind remarks. And I know everybody in here is wondering what I'm wondering is where can we apply for one of those loans? Just kidding. Well, I'm a ex-professional golfer that found his way into the nonprofit sector, and believe me, I've been trying to find my way back ever since. It's a very challenging set of circumstances that we're facing, and it's probably one of the biggest challenges I've ever faced as an individual, as an athlete. I was lucky enough to win a scholarship through my junior golf play to Stanford University. I graduated in economics with a degree in economics, and was part of a national championship team there, which was a wonderful experience. But what I'm doing now in nonprofit and trying to advocate for the Native American people has been far more daunting but far more rewarding. And you certainly can't do those sorts of things without great partners. You can't do that without resources, without strategic planning, and without people that believe in affecting their communities. And that's who we have up here. We have a collaboration of individuals that have a vested interest in nurturing these seeds of Native health. How does a seed become fruit? How does it become a vegetable that is healthy for our bodies? You nurture it, and we're trying to nurture these things with education, with information, with research, with resources. And that's sort of where my degree helped me in developing our strategy at the Env3 Foundation. Is we wanted to base everything off of sound research. We wanted to work with communities that wanted to be true partners and wanted to meet us halfway. One of the biggest question is, how does this health epidemic in this country that our young people are facing, how does it affect us? Me, not just Native people, but me individually. Our healthcare costs are rising at dramatic rates. I don't know if a lot of you, like myself and my family, when you shop for your healthcare plan at the end of the year, it's like, wow, it's going up another $100, another $200. And it's got to come from somewhere, because we can't go without healthcare. And it's 3 times more expensive to deal with the effects of chronic illness than it is to prevent it. And so, just doing the math, if we can educate our young people on how to take care of themselves, why it's important, how to source healthier foods, how to shop at their local grocery stores, how do we address the food disparity issue from a socioeconomic perspective. We talked about social indicators earlier here today. Those are big things that are happening in the nonprofit sector with regard to health and nutrition, is how do we address those things that are having a secondary and tertiary effect on an individual's well-being. And with our work and our research and our partners, I really sincerely feel like we can make an impact in this particular issue. The United States as a whole spends more on healthcare than any other country in the world. We're like the 35th healthiest country. There's an inverse relationship there, and I mean, you don't need to go to Stanford to figure out the math really doesn't equate. But it really comes down to, again, seeds of native health. It all starts with our young people. 1 in 3 kids in this country is obese. And soon 1 in 2 kids in Indian country is going to be obese, which predisposes them to all of these issues, all of these chronic illnesses. Okay, and that's exactly what we're seeking to prevent. And I've dedicated the last 10 years, we're in the 10th year of this foundation, and it's a dogfight. It's hard to raise money. It's hard to find partners. $5 million being dedicated to this, coming from tribal resources, is a huge milestone. It's very, very important that we talk about this, because this is not happening in any other section of Indian country across America. So it really is a reflection on Shakopee, Mdewakanton, Sioux community's commitment to this issue, of their leadership's understanding of what's at stake. And what is at stake is the future of our kids. And that's not a future I'm willing to bet on. I'll bet on the NCAA tournament, but I'm not going to bet on that. So thank you to leadership, Mr. President and Dean, for having us here and being such advocates for Native people at this university. It's important to continue to educate them, and I'm just extremely proud to be a part of this, so thank you.
And we're just delighted to be a part of that relationship now and growing and expanding those connections. In the College of Food, Agriculture, and Natural Resources, you'll find that we're very literal. Food, agriculture, and natural resources, that's what we do. But we know that the food entering our bodies as medicine is essential to healthy and fulfilling lives. But we go on to know that the health of that food also depends on the health of our natural environment, our soils, our water, our plants, and the animals in our landscape. And so what we eat truly becomes who we are as people and who we are in the world. It's why the name Seeds of Native Health resonates so clearly with Sea fans. The seed must have that fertile earth to thrive, and only then can it lead to those healthy lives. And building that connection is what Sea fans has done throughout its tradition, and we're looking forward to working to expand that as well in this endeavor. We look forward to collaboration with the Shakopee, Mdewakanton, Sioux community, the First Nations Development Initiative, and the Notah Begay Foundation. It's an exciting collaboration to work across that scope. And in addition, we're looking forward to being the doorway into the University of Minnesota, because that collaboration requires we work with other areas within our university, which are broad and expansive, to address this broad and expansive challenge we have before us. So within the University of Minnesota and with the Seeds of Native Health campaign, we're going to be partnering on 3 key initiatives. First, we'll help to build mutually respectful cultural interfaces between academic research communities and Native American communities that hold the knowledge informing ongoing food sovereignty initiatives. An example of this type of work comes from Dr. Craig Hassel. He's an extension specialist and assistant professor in the College of Food, Agriculture, and Natural Resource Sciences. And he's developed an American Indian culturally appropriate curricular approach that is being used to bring indigenous knowledge and food traditions into extensions, SNAP Ed, and expanded food and nutrition education programs in Minnesota's tribal communities. Second, we will devise a comprehensive study of Native American nutrition informed by indigenous and biomedical perspectives to create a repository of best practices for recovering health and well-being. This work is anticipated to be done in collaboration across the university, many of whom are here today with us, and will fill and broaden our engagement with the Shakopee Sioux community. Third, we will serve as SMSC's convening partner for a new series of annual national conferences on Native American nutrition to be held here in Minnesota, and bringing together those collaborations across the university and across the Native communities. And details, we'll talk about more of those later as they become, and we'll be working with our partners here to fill out those activities. Let me say that we are excited to be a part of this engagement as Sea fans. We're excited to be working with the Shakopee, Mdewakanton, Sioux community, the Notah Begay Foundation, and First Nations. And I look forward very much to these engaged partnerships. Those are the fertile soils for the Seeds of Native Health. Thank you very much.
Thank you. So we'll wrap up here. I want to take a moment to thank again Michael Notah, President Kaler, and Dean Burr for joining us here and for your organization's collaboration in Seeds of Native Health. Our work is just beginning here, and as this campaign unfolds, we'll have more additional announcements, and that will be coming in the upcoming weeks and months. I want to thank you all for being here. Again, I want to acknowledge our community members are here, Native people who came to join us here this morning. Thank you.